Good morning, everyone. I'd just like to thank Councillor Victor Warrington and for inviting me here today and from Fermanagh Omagh Council. And I'm going to give a short presentation on the Mental Health Charter, which the Equality Commission coordinates. My name is Una Wilson. I work in the Advisory Services team. We provide advice and information to employers and service providers. And I understand from Finbar that this session will be available to employers in the Fermanagh Omagh area, but it will also be available on record version after this. Just want to give a little bit of background in terms of, and I know Siobhan will have given you a far more comprehensive knowledge about some of the issues, but Lancet, the medical journal, has carried out research to look at the levels of mental ill health before and during lockdown. And they assess certain groups are experiencing more distress during the pandemic: women, young people, and preschool aged children. So as the economic consequences of lockdown develop, when furlough turns to redundancies and mortgage holidays expire, and we get into this sort of recession situation, and listening only recently about the large scale redundancies that are beginning to take place, that employers are going to handle quite a lot in the coming months and years in terms of overcoming a lot of the issues. It is also important that the mental health of the people who are within your organisation and leaving your organisation, or if you're in small business, looking at how those issues affect people. Just to give you an indication, people suffering with stress and depression has risen from 21% to 37%, and that was at the beginning of lockdown. There's also issues in terms of how mental ill health is going to affect groups that have been more profoundly affected by COVID, like Black and minority ethnic groups. The Stevenson and Farmer report, which was the report into mental health, looked at this issue, and this was in 2017. And they said 300,000 people lost their jobs because of mental ill health in the UK. That's the population of Belfast, so it's quite a lot of people. I'm going to move on to the next slide to explain more about the partnership that we have within the Commission. Because the Mental Health Charter was not devised by the Equality Commission on its own. It was working in partnership with the mental health charities across Northern Ireland, and looking at the issues from a practice-based perspective of supporting people with mental ill health in work or getting into work. So it was very much based on that issue. So the action measures and the commitments that are set out in the Charter were very much looking at some of those issues in terms of how do you approach policies and procedures and practices that support people with mental ill health in work, but also looking at the more general issues in terms of how do you lead. And I suppose this is where Fermanagh and Omagh Council really comes to the forefront, because all these organisations have said the same thing, that if you're in any type of employment work, it's how the senior leaders lead from the top. We're also joined in this partnership by the Health and Safety Executive for Northern Ireland and the Labour Relations Agency and the charity Business in the Community. Next slide. The Mental Health Charter is voluntary, and so when Fermanagh and Omagh Council signed up to the Mental Health Charter, they were looking at a voluntary commitment, and it is all designed. And so for the small businesses that are listening in on this morning, it's not about having every action measure on the commitments completed. Some organisations say, "Well, I can't sign up because I haven't looked at all the action measures." It's about developing a plan and looking at a plan that's realistic and that can be achieved in terms of those issues. In terms of, it provides an opportunity to put together a puzzle which fits the organisation's size and nature. So small businesses are going to have different things, and a big part of the Charter, which is commitment 4, is about signposting to other organisations and relying on good practice from around Northern Ireland in terms of there's really good practices out there, and I'm going to be talking more about those in terms of signposting. So for instance, one of the good business reasons for investing in mental health is the Stevenson and Farmer report suggested for every pound invested, there was a return of £4. Deloitte Touche did research in 2019, and they said for every pound invested, you were getting a return on investment of £5. And when Lancet, the medical journal, looked at it, they actually referred to the Australian Fire Service, and the Australian Fire Service said for every Australian dollar there was a return of $9.57. So there's a real sense that if you invest in good practice in terms of mental health, that there is a return for employers in terms of looking at some of those issues around sick absence, presenteeism, but also looking at issues around engagement, and bearing in mind that, you know, work has changed considerably since March. We unprecedented change, and HR, human resources, and lots of organizations or small business owners are finding it very difficult to keep up with the pace of change. But at the same time, we still have to look after the health and safety of our workers, and look after how they can feasibly contribute to the working environment in the present circumstances. Just want to refer back to another good practice example. So we had a manufacturing company in Mid-Ulster that adopted the mental health charter 2 years ago, and they said their productivity went up between 2 and 3%, and it was an engineering company. So as the chief executive said, it was all about the numbers. Next slide. This is a quotation from Professor Carey Cooper. He advises the Chartered Institute of Personnel and Development, and he said leadership is key to developing culture, and its success relies upon buy-in and cooperation of all leaders from the board level down. So in Fermanagh Council, you not only have members of your council chamber on your working groups, you also have employees who are feeding into your processes, which always makes for a better process. And in all the mental health charity organisations, and there is over 200 signatories now in Northern Ireland, we have found that the vast majority of them have been successful because of senior leadership involvement and showing that role modelling from the very beginning, and how that approach should link in terms of all those sorts of issues. Next slide. So the charter commitments are very clear. They're to create an open, inclusive environment, workplace culture which displays respect for those with mental ill health. And that's about challenging stigma in the working environment, because when we started off this project, one of the issues is that colleagues in workplaces had quite discriminatory attitudes around other people with mental health, which goes to the story of, you know, in small businesses, 90% of people don't disclose they have mental ill health in small businesses because of the fear of repercussions, of potential of not being promoted, but not being taken seriously in the working environment. So key part of the open, inclusive workplace culture is to challenge that stigma. So we often tell organizations to sign up to the anti-stigma campaign for Northern Ireland, which is Change Your Mind, and you can log on the website. But I'm just going to show you a booklet, and this PDF booklet is downloadable on our website, and each one of those commitments has a set of action measures, and if you hover over each one of the commitments, the action measures will actually display themselves. So that first one really is about leadership, but it is also about mental health first aid training, which I know Fermanagh and Omagh Council put in place for their organisation, and sharing good practice about how that mental health first aid training works. Some organisations have adopted it quite a lot. Department of Communities have used it as well in terms of supporting their staff who work in frontline services for advisory services in terms of benefits. So it is quite a useful thing in terms of looking at those issues. Commitment 2 and 3 are principally about equality of opportunity, and they're about challenging policies and procedures. And in times of COVID, it's time to probably revisit your bullying and harassment policy, because people are not going to be bullied and harassed in the same way. But issues around mental ill health, I mean, in terms of being harassed on the grounds of mental ill health in the working environment, needs to be challenged by employers, and they need to look about online situations, Zoom, all the different platforms that are available now in the working environment. And the Equality Commission provides a service insofar as we will review your policies and procedures free of charge, and we'll also advise you on the practices that you should be thinking about in terms of getting those things right. It is also about employing people with mental health and giving them an opportunity to work in working environments. And by doing all these things, you boost motivation. And one of the I suppose one of the great good practice things I got out of working in the mental health charter is when a bunch of middle-aged men turned around and said that we're talking about mental health and we're getting help, and that's transferring itself into the community. So this is crucially important in terms of those issues. Going back to identifying and providing sources of support and information, in the back of that booklet is the names of all the organisations that are our partners and contact details for them. And they have a range of resources available. So for instance, the Health and Safety Executive at the moment has a great toolkit on managing stress in the workplace stress, which is a big issue. And they also have a video which is accessible for everybody to get onto and look at in terms of those issues. But there is actually specific coronavirus websites and information. But don't forget the public health agency websites as well, in terms of signposting you to local services, and make sure those are available on your intranet if you're a large organization. But if you're a smaller organization, just ensure your staff are aware of those and aware of any assistance programs in terms of access to counselling. And don't forget about the supported employment organizations out there that can help you support disabled people in the working environment. The fifth commitment is around every customer counts, which is about making services accessible for disabled people, so that people with mental ill health are not treated in a discriminatory manner when they access services. So that's about training, it's about information about mental health and changing attitudes around mental health and not stigmatizing some of these issues. I'm going to move on to the next slide now, and I'm just going to look at some of the issues in terms of challenging the conversations about mental health in Fermanagh and Omagh Council. Looking through the charter commitments, so the council looked at developing mental health in partnership with the employee group and also with their senior management team, supporting managers with information to promote a positive mental health in the workplace. They looked at developing and delivering mental health first aid, and they were coordinating very much so with local charities. I suppose one of the things that captured my imagination when we asked Fermanagh and Omagh Council to share good practice 2 years ago at a seminar for other employers was the action you took in terms of putting out information in local barber shops so that young men would know about where to get help, in terms of ensuring that people would have more information about if they were contemplating taking their lives. So at least information about suicide prevention organisations in the local area were being passed out. The other thing we would suggest is share your good practice on hashtag MHCharterNI, because we can all learn from each other. And okay, we're all saying about coronavirus, we're in this together. We're in this together in terms of mental health. We're only going to change mental health if we all work together, and that is crucially important in terms of those issues. But make sure that your individuals, if they work within larger organisations, are aware of the employee assistance programs you have and bringing those to the forefront, and asking senior management teams to look at providing opportunities for people to talk. People are feeling very lonely. It's coming up to Christmas and people have lost people. Make sure you have information about grieving, because grieving is taking on a very different phase in coronavirus, where people don't have the great support they often have in their local community. So make sure you have information about that, because it's crucially important in terms of those issues going forward. One of the suggestions in the Stevenson and Farmer report was that senior managers should have performance indicators around mental health in order to ensure that they're reporting on this at a senior level, but also in the context of making sure there's responsibility for it and it's not just another tick box exercise. Next slide. So in terms of how are you supporting staff from work, from home or at work, and I was talking to some of your colleagues there in Fermanagh Council, and they were saying there was workshops on anxiety and working from home and different issues like that. But smaller business might find it harder, so they might want to check out some of the local charities in terms of the support that's available. If individuals are finding financial hardship, about some of our partners have specific mental health and financial services like Mindwise, so you might find that quite useful. In terms of how can the Equality Commission help, so I think I've pretty much talked about in terms of supporting staff working from home or at work, but I just want to revisit one particular issue, and it's about looking after children and people acting as carers. A lot of Aware, Inspire, Action Mental Health, and I don't want to leave anybody out, business in the community have a lot of information on their website about supporting people in terms of those issues. And for postnatal depression, both Aware and Mindwise have specific projects on those, and they have a specific one west of the Ban, so it is quite useful in terms of those issues. So I've already talked a little bit about how the Equality Commission can help in terms of reviewing policies. Thinking about, and it is the hard question coming up to redundancy, before you set your, in terms of the criteria for redundancy, if posts are going to be actually made redundant, then you need to look at the criteria on which you're going to base that redundancy. Make sure that there's no non-discriminatory issues in those, and we have a workshop next week online in the Equality Commission on redundancy, but also you can ring our advice line for information on those issues. Also think about other policies, as I've already said, about harassment, but also in things, performance issues, performance management issues, also in the context of in terms of also downloading stress policies, which are available from the Labour Relations Agency. I've only talked briefly about some of the examples from employers across Northern Ireland, and Fermanagh and Omagh Council is one of those organisations that has helped us to share good practice and to help other organisations see the good practice that's been adopted by your council area. It is always a movable feast, and I suppose we'll always have to do more. We'll always have to listen more, and those are conversations we're going to have to continue to have. But let's work together to share that good practice. Next slide. I want to finish with this because I thought it was very appropriate in terms of before I go on to the actual quotation, I'm just going to say that the theme of mental health Mental Health Week this year was kindness. And in our initial research back in 2008 showed negative attitudes towards people with mental ill health in the workplace and as neighbours. We all live in a community where work or access to work is crucial for good mental health. And employers in Northern Ireland are doing good work, but we need to showcase it more often. I thought this quotation from Marie Curie was particularly apt because in the context of vaccinations and all the rest, nothing in life is to be feared, it is only to be understood. Now is the time to understand more so so we can fear less. So hopefully in the context of mental health, Fermanagh and Omagh Council, with the awareness raising sessions that you're having this week, will begin to break down barriers for disabled people, both in public life and in terms of changing attitudes towards mental health in the working environment and in the wider community. Thank you very much for your time this morning. I wish you a wonderful conference. I'm sorry I can't be there, and I hope you enjoy the rest of your seminar. Thank you.